Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials, Orthopedic Surgeon. Today we'll discuss about orthopedics and its most common orthopedic problems. Orthopedics is the study of skeletal, muscular disorders. That's skeletal means bones, joints and muscles attached to it and the soft tissue attached to it. So most commonly we hear is joint pain, that's called the arthritis. And then we see the fractures commonly. The fractures are variable. The fractures inside the skin is called a simple fracture. The fracture exposing outside is called compound fractures. We have a comminuted fracture, undisplaced fracture, displaced fractures likewise. So apart from that, the orthopedics has tumors, bone tumors, whether it's benign or non-cancerous and malignant or cancerous disease. And apart from that, we have osteoporosis. Osteoporosis, the disease of bone, because of the deficiency of the vitamin D, calcium and other minerals like magnesium, potassium, manganese and rest all nutrients for the bone. And then we can think of tendons and muscles which are attached to it cause certain inflammation of the tendon is called tendinitis, and sometimes there is a degenerative rupture of the tendons and there is a muscular spasms and there will be muscular tumors and there will be muscular injuries. So these are the soft tissue injuries where we see commonly which need to be treated. And then when you see the joint dislocations and intra-articular fractures are more often. The joint dislocations like shoulder joint, hip joint and knee joint are and elbow joints are common to get dislocated, and other joints in severe trauma get dislocated. And then when we think of the soft tissues of the skin or rheumatoid arthritis, inflammatory diseases like arthritis, we see immunological disorders like rheumatoid arthritis and then other arthritis like psoriatic arthritis, gouty arthritis and non-specific rheumatoid arthritis. So these are variable diseases we see. And then the old age arthritis, otherwise we call it as degenerative osteoarthritis of the knee and hip is on and off happens. So when we should know about the orthopedics in details, then there is a skull bone or neck bone or backbone problems like facet joint is called spondylitis, bony degeneration or bony deficiency of vitamin D, calcium leads to osteoporosis called spondylosis, and then spondylolisthesis is the disease where the lumbar vertebra get dislocated or lumbar vertebra is one vertebra or the another vertebra, there is a possibility of displacement is called spondylolisthesis. So spondylitis is the disease of the vertebral bodies, facet joints where there will be inflammation.